for a conversation produced by our underwriter, Gilead Sciences, about redefining care, the future of women's health and rare disease innovation. Please welcome Betty Chiang, Vice President of U.S. Medical Affairs Virology at Gilead Sciences, and Gené Ende, Vice President of U.S. Medical Affairs at Gilead Sciences.
I feel guilty that I'm not working. I feel guilty about not being able to do so much around the house. I see the worry on my boys' faces sometimes. Over this last year, I have become more aware of what I can and can't do. I'm not as hard on myself as I would have been at the beginning. Only one of the GPs that I see at my surgery seems to know anything about it. If I haven't had a sleep in the afternoon, I just feel in a bad mood. I've got pains as well. My body doesn't do what it used to do. When I'm walking upstairs, I sometimes feel like my legs are in mud and I can't lift them out. There's been a couple of PBC conferences that we've been at, but you want more people around you who know what you're going through, and I think that has been helpful to meet those people.
First and the individual first, because that's the one thing that we do every single day as Gilead is how do we make people's lives better? And I know a lot of you have heard about many diseases. If I say to you, who's heard about diabetes? Okay. If I say, who's heard about HIV? Okay, those are common. Diabetes, 38 million odd people in the US of A has got diabetes. But here we're talking about a disease called PBC. Who knows what PBC is? Wow. Okay, primary biliary cholangitis. Big mouthful. So I'm going to ask Betty to give us a little bit of more information about PBC.
So if you look at the word PBC, I actually will start with the fact that it stands for primary, being the first, biliary, which is just your bile ducts, and cholangitis, which is inflammation of your bile ducts. What's interesting is when we went to go look at PBC, they used to actually call it primary biliary cirrhosis, because that's how people showed up. They came in with advanced disease where their liver was already damaged, that to the point that some actually needed a liver transplant.
And Betty, we know the liver is quite resilient. So.
Oh yeah, we do. I think every one of us test it out several times a day, and see what our livers can do, right? Mm-hmm. But there is a point where it doesn't do so well.
So you need, 70 to 80% of the liver damage before you start getting signs of liver disease?
Yeah, you need a significant amount. So with this primary biliary cirrhosis, cholangitis, you may not even realize. In fact, 60% of people don't even realize that they don't have any symptoms at all. So when people actually do come, they're having some manifestation of some liver damage already, right? But the symptoms are actually that they complain about. You saw what she said. I don't know about you, Gené. I kind of feel like that today a little bit. Fatigue. You're tired, and it's described as exhaustion, a fatigue that is very hard to describe. And it's to varying degrees, of course, along the course of their disease, and also itchiness, pruritus, something that makes them so uncomfortable.
And we just heard about sleep. So if you've got bad pruritus, you can be so itchy that you don't actually sleep at night. And we've just heard how important sleep is.
But I just would say to you guys, how many people, raise your hand, have you ever had fatigue? Right? So, and what's really important here is the person I noticed said, when they went to their GP, their primary care doctor, they hadn't heard of this before. So I would say not only are we here because of awareness, but if you're going in and seeing your healthcare provider, they have to, on the other end, recognize that what's going on to actually even think to actually diagnose. And a lot of the blood tests that you order, specifically a comprehensive metabolic panel, contains a blood test called alkaline phosphatase. And that test being abnormal is one of the first things to clue you in that you should be working up this person to see if they have PBC.
But we also need to take into account, if you look at people going to go and see their primary healthcare professional, about 10 to 20% of the time, they're going because they're suffering from fatigue. And fatigue can be for multiple different reasons why people are tired. I'm generally fatigued because I take my thyroid hormone with coffee, which is a no-no, which is a bad thing to do, bad doctor, bad patient. But at the end of the day, it's the second most common reason, or first or second most common reason why somebody actually goes to their primary care physician is actually fatigue. And it can be for multiple reasons. They can have anemia, they can have thyroid disease with a low thyroid, or they could have PBC. And women are notoriously bad, and this is a condition where you've got 90% of the individuals who are impacted are women. And women are notoriously bad for looking after other people. We know it's often the woman that's taking the significant other to the doctor rather than taking themselves to the doctor to care for themselves. And they're busy and they're doing a lot of things, and they don't necessarily look after themselves. So it's the real big reason to go out and educate people. Not because we want everyone to be so nervous to go out and every time they feel tired I've got PBC, because we both went through medical school, so we've had lots of diseases that we think we've had as we've learned about them, but about really making people aware and also educating the healthcare professionals out there to take notice, and particularly if they're seeing some abnormalities coming through on liver results, that they actually take action and they start looking for something that's a rare disease, something that's impacting, 130,000 individuals in the US. So it doesn't sound like a big number, but it is a significant, because if you that one individual that it impacts, because everyone gives stats, like you've got a 13% chance as a woman to have breast cancer in the US, for example. But if you that one person, that statistic is meaningless. So it's really important that we do pick up these individuals to give them the care, because if we care for them, it makes a difference.
So I really love having this platform. Hey, by the way, Gené, did I tell you that I used to work in this neighborhood?
You did.
So I used to work right a few blocks away, and this is actually where I lived and took care of people who lived and worked in this community. And I think that that's what I want to, when you're really passionate about taking care of people and really caring, you really got the person in front of you and listen, right? So we deserve to have, patients deserve to have their primary care doctors really know them and hear what they're saying, and then to be able to say what's going on, and then to take it seriously, and then to be able to order exams and connect them to this. Because there are treatments available, and there are treatments that are available if the first regimen doesn't work. So what we could be doing is getting, and I heard a common theme, which is let's get to people not when they're at an end stage, let's get them earlier, and let's get people diagnosed so that they can be on the right treatment for them as soon as possible.
And we know if we treat these individuals that they have a life expectancy similar to the general population, which in the US, we heard earlier, is a little bit lower considering how much we spend on healthcare. But if you don't treat them, or if they don't respond well to treatment, then you're looking at a life expectancy of about 10 to 15 years. So really getting people diagnosed, and these women diagnosed predominantly, and the 10% of men that it impacts, becomes fundamentally important and significantly life-changing for people. So I hope you've learned a little bit about primary biliary cholangitis today, and thank you.
Check your alphos level. Okay. Thank you.